stress in humans, how humans perceive stress and response to stress differently compared to other animals, and what is the normal stress response. Then we'll see what happens if stress is prolonged for a longer period of time. So acute stress versus chronic stress. Then we'll also see what happens if one is exposed to stress early in the childhood compared to when one is exposed later in life. The development was normal, but later in the life one is exposed to stress. So most of us will experience some or other kind of stress. So, but if in the developmental period itself someone is going to extreme stress, so how does that differ from somebody experiencing stress later in the life, having a normal childhood? Then later, what is the impact of stress on the mind and body? Later, whether the neurobiological changes which occur as a result of stress, are they reversible or are they permanent? So we'll try to answer these questions throughout my presentation. So first of all, what is stress? So for formality's sake, stress is something which originated from physics. It was initially used in physics, referring to strain on the materials. So Sir Hans Ley was someone who started using it in biology. He reported it as a non-specific response of the body to any demand which is placed on it. So a non-specific response whenever somebody faces some kind of burden, any kind of demand, any organism faces. So that is when a response comes, which is called a stress response. Okay. So a more refined definition would be stress is the body's physiological and psychological response to a perceived threat, perceived real threat or an imagined threat. So whenever there is a real threat or an imagined threat, so how the body responds physiologically and psychologically, that is what is stress. So why does the body respond is because to bring back the balance which is disrupted by the perceived threat. So stress is the body's physiological and psychological response to any perceived real or imagined threat. Okay. So why do humans experience stress? So why is it required? So we know that all of us know about Charles Darwin's theory of evolution. So it talks about natural selection. So he said that it is not the most intellectual or most intelligent or the most strongest of the people who survive. It is usually the someone who is more adaptive and more adjusting to the changing environment. So we are living in an environment which is changing, stressful. So what was our environment as a child is not the same when we are adults. So we are living in an ever-changing, rapidly changing environment. So those who are able to adapt and adjust to the environment are the one who is going to survive. So from the evolutionary perspective, so early humans, so our ancestors needed energy to rapidly mobilize. They needed to be alert. They needed to be able to escape from the predators. So in order to survive from the predators, they needed all this. So because of this, the stress system evolved. So it is not a design flaw, it is a survival tool. So which has shaped by the natural selection in order to help our ancestors to survive. So over a period of time, over the evolution, what has happened is the stress system has become hardwired in our system. So that is why we experience stress. So Randolph Nesse is a psychiatrist who predominantly works in evolutionary psychiatry. So he said that our emotions, the unpleasant emotions which we experience and the physiological states which we experience, unpleasant physiological and emotional states which we experience are not to make us happy, it is to keep us alive. So evolution always attempts to keep the species alive, not to keep us happy. So is stress unique to humans? No. So stress biology, the stress system is something which is a conserved biological phenomenon which is seen in even vertebrates, some invertebrates. It is seen in mammals. The same neuroendocrine system, the HPA axis and the sympathetic nervous system is seen in mammals also. In the fish and birds are also have a similar kind of system in order to respond to the stress. Even insects have the neurohormonal responses. So in order to escape from the dangers they face. So this suggests that the stress response is an ancient biological program which is evolved to help survive over millions of years. Okay. So if it is seen in other animals also, how different is it in humans? So how different the stress response is in humans? So what makes humans unique is that they have a complex cortex, particularly the prefrontal cortex, which is capable of thinking abstractly, which is capable of having a good memory, imagination. So this evolution of the human brain, the enlarged prefrontal cortex, which is also the neocortex, which is the newer in the evolution, which has so much of capability of abstract thinking and imagination, was prepared for, has evolved for some good reasons. But at the same time, this can also be a disadvantage because it helps you anticipate future threat. It actually is an advantage that it anticipates future threat and we get prepared for that. And we can ruminate about past events. So this capability itself in the long run, what happens is this keeps on, when we keep on anticipating future stress or future threats, or we keep on thinking about past events, we keep on activating our stress system in the long run, which can have a negative effect on our body. So basically, this is a maladaptation to the modern world because the stress system has evolved, was initially evolved to, because our ancestors needed to escape from the predators. They need to escape from the physical threats. But in the modern day, we have a lot of psychological and social challenges which acts as modern stressors. So, for example, it may be exams for most of us, work pressure, relationship conflicts, which are more and more nowadays. So, economic insecurity, social isolation. So, all these can act as stressors, psychological stressors. So, which our ancient biology, there's a mismatch between our ancient biology, which is the stress system, and the modern environment, the changing environment, that is the newer stresses, that is the psychological stressors. So, when the psychological stresses, we are living in a society where every day, we are living in a time where we experience stress every day in one form or the other. Okay. So, this continuous experience of stress keeps our stress system activated. So, a continuously activated stress system can be problematic in the long run. That is, we'll see how it's problematic. So, first let us see what is the normal stress response. So, for that, I would like to present a case with a 25-year-old medical student waiting to be called inside the Viva hall. So, his heart starts racing, he starts sweating, so he feels tense. So once the exam begins, he answers confidently. After leaving the hall, he feels relieved. So why is that? So he was having heart racing, his palpitations, he was having sweating, but he felt alert. So this is because of the activated stress response system. So why was he able to answer confidently? So was the stress system responsible for it or anything else? So how useful is the stress system in the short term? Okay. So the immediate response would be, so whenever one is faced with any kind of physical or psychological stress which I just listed, what happens is within seconds. So whenever the amygdala is the main stress detector. So your amygdala detects the stress even before it comes to your conscious awareness. So once the amygdala detects stress, it activates the sympathoadrenomedullary pathway. This is one of the two pathways which are activated in the stress. So this is something which activated first. So when the amygdala perceives stress, it activates, it stimulates the hypothalamus. The hypothalamus activates the sympathetic nervous system, which stimulates the adrenal medulla to release the norepinephrine and epinephrine. So this is required for the immediate response, which is responsible for the symptoms the student was experiencing. That is palpitations, increased blood pressure, shortness of breath, and increased glucose levels in the blood. So these were the immediate response to the stress. So this is a normal stress response one experiences when one is faced with stress. So what happens if the stress extends for a few more minutes? So what happens is your hypothalamo-pituitary adrenal axis comes in. So the hypothalamus first stimulates the stress sympathetic nervous system, and if the stress is prolonged for a longer time, then the pituitary adrenal axis is stimulated. So the paraventricular nucleus of the hypothalamus releases corticotrophin releasing hormone, which in turn stimulates the pituitary to release adrenocorticotrophic hormone. So which again acts on the adrenal cortex. So the immediate response was from the adrenal medulla. Now the prolonged response is from the adrenal cortex, which releases the cortisol. So what does cortisol does is it increases the glucose availability, it supports the cardiovascular tone, and it modulates the immune response. So it also gives feedback to all the hypothalamus, pituitary, and hippocampus and the prefrontal cortex to shut down the stress response when the challenge ends. This is what is a normal stress response. So this is a pictorial representation of the normal stress pathway. So stress is adaptive. So the normal stress response is adaptive because it prepares our body to perform optimally. So short-term activation, it enhances memory, attention, and motivation. That is why the student was able to perform better in the exam. So once the stress is resolved, the system sets off. So what happened with the student is that both the fast and the slow response, that is the sympathetic system and the HP axis were stimulated. So both the adrenaline was in action initially, and later cortisol took over. So once the stress gets over, the system is shut down. So this is the normal stress response. So what happens if the stress persists for a prolonged period of time? So if, like most of us experience stress every day for one or the other reasons. So if the stress is persisting for a prolonged period of time because of the modern psychological stresses which we are exposed to, so what happens is our system will not get time to recover. So there is a prolonged repetitive activation of the stress system, that is the amygdala is repeatedly, continuously in a hyperactive state. So examples of chronic stressors can be somebody who is giving care to a terminally ill, somebody in the family is suffering from Alzheimer's or some terminally ill, and only one person is taking care of that person. So there can be stress giver burden, caregiver burden. So ongoing conflict, relationship conflict, financial insecurity, somebody who has experienced a traumatic event, or that can be a repeated reminder, so post-traumatic stress disorder. So in these cases, the stress system is in a continuously activated state. So what happens is the hyperactive amygdala leads to persistent fear and vigilance. So because the amygdala is hyperactive and there is a consistent release of cortisol, there is a impaired feedback. Because of the impaired feedback because of the down regulation of the glucocorticoid receptors on which the cortisol acts. So cortisol acts for the feedback on the glucocorticoid receptors. There is down regulation of these receptors. So what happens is the feedback mechanisms fails. There is increased cortisol response, so which leads to HP axis dysregulation. So in the long run also, because of excitotoxicity, because of the glutamate and cortisol, there is hippocampal atrophy, and the prefrontal cortex, which acts as a brake, which acts as a controlling master also is affected. So because of which there is impaired cognitive control and emotional regulation. Also there is neuroinflammation because initially cortisol in the short term, it suppresses, cortisol initially suppresses the inflammation. But in the long run, when the stress continues for a longer period of time, what happens is it activates the microglia and inflammatory cytokines, so there is neuroinflammation. And also autonomic imbalance, which also leads to hypertension, tachycardia, and immunosuppression. So this is the effect of activating the stress system for a longer period of time because of the modern psychological stressors. So this table gives an overview of what happens if there is a chronic stress versus acute stress. So acute stress usually lasts for from minutes to hours, whereas chronic stress from weeks to years. So what happens in the acute stress is the HP axis is activated and it shuts down normally, as it happened in the case which I presented just now. And if the HP axis is stimulated continuously in chronic stress, what happens is it fails to shut down. There is impaired feedback. Cortisol is a short acute stress. There is just a short spike which helps us actually in the short run, but in the long run, sustained elevation of cortisol can have detrimental effects on the different parts of the brain. So there can be a blunted response. So in the short run, there is enhanced focus and memory because of which the student was able to answer properly. But in the long run, what happens is the increased cortisol can damage the hippocampus, amygdala hypertrophy, because the amygdala is in a constant state of constantly active. The prefrontal cortex is impaired, so it is not able to cognitively control. So because of which the acute stress is an adaptive and a protective one, whereas chronic stress is a maladaptive and disease promoting, because in the long run it can lead to a lot of medical and psychiatric illnesses. So acute stress is adaptive and protective. So once the stressor ends, the negative feedback via cortisol receptors in the hippocampus and the prefrontal cortex shuts down. So this is called allostasis, whereas when the stress is prolonged for a longer period of time, what happens is there is a allostatic overload and there is a wear and tear of the brain and the body. So till now we saw what happens if the stress is prolonged for a longer period of time. So we also need to look at what happens if one is exposed to stress in the early childhood. So during the developmental period, so how is it different when one is exposed to stress as a child and as an adult? So what happens as a child, the brain is still developing. In a developmental period, first 18 to 25 years of age, when someone is exposed to extreme levels of stress, it can have a profound effect as an adult also, because the brain is still developing. So it can leave prolonged, long-lasting neurobiological imprints. So because of which somebody who is exposed to stress in a developmental period can have emotional dysregulation, there can be cognitive impairment, and they are vulnerable for psychiatric illnesses in the long run. So in contrast to somebody who is exposed to stress in the adult life, because the brain is already mature, all the maturation has happened, so there cannot be significant effect on the brain. So even whatever has happened, it can be reversed. So the timing of the stress also is very important. So stress during the developmental period can have lifelong patterns of emotions, cognition, and health. So this table gives an overview of what happens if one is exposed to stress in the early period of life. So because in the early period of life, the brain has already told it is developing, it is still plastic. So the HP axis, if one is exposed to longer period of stress, it becomes permanently dysregulated. The amygdala is always in an overdeveloped, hyperactive. So you can see somebody who is exposed to stress in the early childhood, they may startle whenever they are exposed to minor amount of stress. Okay, the hippocampus is reduced growth, which can have elastic impact. Epigenetic changes also can have profound and long-lasting effect. So because of which they are vulnerable to psychiatric disorders in the long run compared to somebody who is exposed to stress in the adult life itself. and most of the changes in the adult life are likely to be reversible. So what is the impact of chronic stress on the body and the mind? So what happens, the psychological effects, it can have a significant effect on the cognition and attention, because the chronic stress can lead to damage of the hippocampus. We know that hippocampus is needed for attention, memory. So there is poor concentration, memory lapses. So one becomes indecisive, not able to take decisions. So because of the prefrontal cortex suppression, there is impaired judgment. One is not able to judge, plan, and one is likely to be impulsive. So there is, you can see a lot of emotional dysregulation because of exposures to stress in the early childhood. So emotional dysregulation, that is heightened amygdala activity, leads to anxiety, irritability, fear, emotional dysregulation, because of which they are also vulnerable to develop a lot of psychiatric disorders, stress-related psychiatric disorders like depression, anxiety, and post-traumatic stress disorders. Coming to motivation and reward, so someone who is stressful for a longer period of time is likely to lack motivation, likely to be burnt out, particularly in healthcare professionals working for a longer period of times. Then there can be disturbed sleep, fatigue, and non-restorative sleep. So what was meant to be protection, the stress system, becomes a poison in the long run if it is continuously in an activated state. So the post-traumatic stress disorder, there is lower cortisol, overactive amygdala. The depression, there is high cortisol and feedback failure. Anxiety, there is misfiring of the alarm system. So what is the impact on the body? As we know, that the cardiovascular system is something which is most commonly affected because of the increased sympathetic tone. There is tachycardia, hypertension, because of the chronic cortisol and catecholamine exposure, leading to endothelial dysfunction and inflammation. There can be increased risk of heart disease and stroke. Metabolic system, there can be metabolic syndrome, insulin resistance, central obesity, and type 2 diabetes. Immune suppression, so when one is exposed to stress for a prolonged period of time, if one has any wounds, there will be delaying of wounds because of the immune suppression. The gastrointestinal system is well known to be involved. Functional bowel disorders, irritable bowel syndrome, and nausea, bloating, ulcers are well known stress-related syndromes. The musculoskeletal effect and reproductive system is also affected. There is reduced libido, irregular menstrual cycles, decreased fertility because of prolonged periods of stress. Also the musculoskeletal system, headaches, backache can be stress related. In the long run, because of the cortisol, prolonged cortisol release, bone resorption can lead to osteoporosis as well. So we saw how stress affects in the short run. What happens if we are exposed to stress for a prolonged period of time? What happens if we are exposed to stress in early childhood? So what are the effects of stress on the body and the mind? So are this reversible or not? Are the neurobiological changes reversible or not? So many of the neurobiological changes which are caused by chronic stress, most of them are definitely reversible with a lot of therapeutic interventions. Maybe it is stress reduction, psychotherapy, medications, supportive environments. All these are going to help you reverse the neurobiological changes which happen in the stress. But it also depends on the duration of the stress, the extent to which you are exposed to stress, the severity of the stress, and the timing of the stress. As already told, someone who is exposed to stress in the early childhood, the developmental period, is less likely to be reversible. So this table shows what are the effects of the chronic stress and what is the potential for recovery. So hippocampus, what happens is there is decreased neurogenesis dendritic. So memory impairment, which can recover because of, the chances of recovery are high because of neurogenesis. The prefrontal cortex leads to poor attention and emotional control. So there is also chance of recovery if there is a cognitive training, mindfulness therapy is done. Amygdala is also partially reversible. Therapy with SSRIs, selective serotonin reuptake inhibitors, can normalize reactivity. So, coming to the end, Bruce Perry is someone who has worked significantly in the childhood trauma. So he says he has a model which says this neurosequential model of therapeutics, which says that the lower parts of the brain, which organize first, are more likely to be affected when the child is exposed to stress. So the brain stem is something which is more commonly affected. So he gives a model of therapy. I don't want to go into detail because the further sessions are on that. So I will end with saying that severe prolonged stress during early developmental period can cause more persistent alterations in the brain wiring and stress reactivity. So however, even in such cases, therapeutic interventions can build compensatory circuits and hence function despite structural loss. So overall summary, stress is an evolutionary